Hello, my name is Dr. Philip Ridgway, and today my presentation is over my Quality Improvement Project for the OSU Medical Center 2026 Quality Improvement Symposium. My project is titled Survey on Inpatient Non-Physician Staff Perception of OMM. My faculty advisors for this project were Drs. Mark Tai, Leslie Ching, and Cameron Henderson, DO. The background for this project is that there's very little literature published regarding how staff that function in the hospital setting that are not osteopathically trained physicians assess and view OMM's role and utility in helping patients in a wide variety of areas. Additionally, little literature is available regarding how staff that is, again, not osteopathically trained view OMM and see if it is different from physical therapy or chiropractic treatment. Our aims for this project were assessing two things. One, if we could assess from a multidisciplinary standpoint various aspects of OMM and staff's understanding of these aspects, and asking if they knew how OMM affects patient care, and also asking if staff is aware of how OMM, or if OMM is different and distinct from chiropractic treatment and physical therapy. Our methods were publishing a survey that was available on the OSU Medical Center Ozone webpage that was available from February 17th to April 7th, 2026, asking several questions. One, we wanted to know if survey respondents felt comfortable stating what OMM is, if they knew that OMM was different from physical therapy, if OMM was different from chiropractic treatment, and then if they have been to one of our Friday noon clinics at the OSU Medical Center. This is a clinic held once a month in which any staff at OSU Medical Center can receive OMT for various complaints and concerns. Our following questions on the Likert scale of 1 to 5, 1 being completely disagree, 3 being neutral, and 5 being completely agree, we're asking about various aspects of OMM and how it benefits patient care, regarding from working and integrating well into workflow, helpful for medical symptoms, helpful for patient satisfaction, pain control, and recovery. These are assessing underlying assumptions that staff may be having and assessing if they have a subconscious understanding of some of the osteopathic tenets in regards to pain control and patient comfort, understanding that the body, mind, and spirit are a unit, and OMM can help assess this. In regards to patient recovery, that gets towards the understanding that the body is self-healing and self-regulating, and OMM helps the body facilitate this. And in regards to reciprocally interrelated, all of these questions also assess that. A small financial incentive of being entered into a drawing for a $25 digital gift card was advertised to all participants in the survey. Out of the 77 survey respondents, 62 were identified to be in roles that were considered patient-facing. If you look at Table 1, you will see that we had these categories broken down into nurses that work on the general medical floor, ICU, labor and delivery, and then individuals that worked in the rehabilitation department, the radiology department, emergency room, surgery, suites, pharmacy, and other, if there were fewer than 3 respondents to a category. If you can look at Figure 1, you will see that this is the average scoring of all of our questions on the Likert scale. Questions 2 and 7 were chosen to be further investigated due to having a lower on average scoring. Question 2, we saw that higher scores were available for the nursing staff on the general medical floor, ICU, and L&D, and generally less favorable for those on multiple floors, such as rehab, radiology, and emergency room. Question 7 is available on Figure 2 to see how this distribution varies and is not consistent across these multiple different roles. Additionally, we tabulated our data on whether or not individuals that responded, whether or not they understood OMM was different or saw OMM as different from chiropractic care or physical therapy, and whether or not they had attended a noon clinic based on these two pie charts below in Figures 3 and 4. You will note that there is a very small amount of people who have attended a noon clinic and feel that OMM is the same as either chiropractic care in Figure 3 or physical therapy in Figure 4. Overall conclusion based on these average scores is that staff view OMM as generally helpful, although workflow and patient recovery questions show that there is more of a lean towards neutrality and not a total agreement that OMM is helpful for these categories. Also, there is fairly good perception that OMM is different and distinct from chiropractic care or physical therapy if they have attended a noon clinic. Our next steps would be to publish this in an article where we could more fully expound on this data, advertise our noon clinic for better awareness of what OMM is, and collect further data to increase our statistical power. Thank you very much for your time.